Guidance on when to use personal protective equipment, PPE, has changed frequently in the past few weeks. However, advice on how to use PPE safely has remained constant. The purpose of this short video is to reinforce the safe use of surgical face masks. For infection to take place, coronaviruses, as with other respiratory viruses, must gain access to your mouth, nose or eyes. To achieve this, viruses have developed successful strategies. When an infected person coughs or sneezes, viruses are expelled as droplets, termed droplet spread. These droplets rapidly fall out of the air onto surfaces and can travel up to 2 meters. A fluid-repellent surgical face mask together with eye protection provides an effective barrier to droplet spread, capturing the virus and stopping it gaining access to your mouth, nose or eyes. Viable virus may be present on the surface of the mask or eye protection and can be a source of cross-infection if either are not used safely. In particular areas, it is recommended staff do not change their surgical mask and eye protection between patients whilst working within designated boundaries for that session. A session ends when the staff leave the designated care setting exposure environment. This helps preserve PPE stocked, but more importantly, by reducing the number of times the PPE is removed, lessens the risk of acquiring infection through improper removal. It is of paramount importance that the mask and eye protection after placement are only touched at the time of removal using the correct doffing technique. PPE should be disposed of after each session or earlier if damaged, soiled or uncomfortable. In these images, by touching the mask, virus has been transferred onto a hand, which has then inoculated the mucous membranes, resulting in infection. Although this is shown as another person in practice, this is likely to be the wearer of the mask if, for example, they move the mask and then touch their face. Alternatively, virus can be transferred to other surfaces, which are then touched by other staff, resulting in them acquiring infection. You should never touch the front of your mask. Only wear it in the correct position, not allowing it to dangle around your neck. Do not keep a used mask in your pocket or draped on your arm. These practices are not safe and must be avoided. Failure to wear or remove mask and eye protection correctly not only places yourself at risk, it places your colleagues and those in your household at risk. Therefore, in summary, once in place, do not touch eye protection or mask. Use correct doffing technique to remove. So for eye protection, use both hands to handle the straps by pulling away from face and discard, then decontaminate your hands. And for the face mask, untie or break bottom ties, followed by top ties or elastic, and remove by handling the ties only. Lean forward slightly, discard. Do not reuse once removed, and then decontaminate your hands. These posters will soon be on display in the Trust. Please read them and follow the guidance, thereby helping protect everyone on site and those in your homes.